Hi everyone. Now today we are going to discuss about an anomaly which is though rare and even diagnosed a little late, somewhere in the late trimester. That is vein of Galen aneurysm, or the name that we give is vein of Galen malformation. So what is actually vein of Galen aneurysm or malformation? Let us come to that first. Now, I've already told you it's a rare disorder, and the two names are given, vein of Galen malformation or vein of Galen aneurysm. Why these two names are given? Because actually it is a malformation of arteriovenous type, right? It's an arteriovenous malformation. So there are multiple arteriovenous shunts which will be draining into the median cerebral venous collector, and that is the persistent median prosencephalic vein. In other words, there is persistence of the embryonic stage of the vein of Galen, that is the median prosencephalic vein. Ideally, it should regress, but it does not regress, and as a result, what happens, there is connection between the neighboring cerebral arteries and this vein, and this leads to its dilatation and forms an aneurysm, right? So that is why we call it a vein of Galen aneurysm, but actual pathology is there, that is the arteriovenous connections. There are arteriovenous connections. I've already told you that it is detected very late, and now, since there is a connection between an artery and a vein, so what is going to happen? The high blood flow from the artery will rush into the veins. As a result, there will be a left to right shunt, and this would lead to venous overload, leading to right heart failure. So, what is the problem that the baby may face? They may be having high drops, right? Right heart failure problems would be there. Then it also says that there could be hydrocephalus. Why there could be hydrocephalus? Because see, it's a mass lesion, it's an aneurysm, it's kind of a mass which may compress over the ventricular flow system, and it may block the ventricle, leading to the dilatation of the ventricles and hydrocephalus. Definitely has a poor prognosis, and I've already told you the reason for that. And yes, in some cases they've tried embolization, which might help, but still the results are not very encouraging. Now let us see the case as such and what are the things that we see. Now this was a patient who came to us somewhere, I think, around 28, 29 weeks of gestational age. She did not have any ultrasonographies done before. And what we observed, what was prominently seen, that there was a cystic area in the brain, an additional cystic area in the brain, multiple rather, I should say, we could see cystic areas in the brain. Now, normally, what are the cystic areas that we see in the midline? Let's talk just about midline. Normally, what are the cystic areas we see in our brain in midline? The cavum, septum, pellucidum primarily. And sometimes the third ventricle, in rare cases, it may be a little prominent, or the fourth ventricle, which may be a little prominent. Those are the cystic areas that we see in a normal situation. But in this case, what we observed, like in this picture, what you are seeing, these are the frontal horns of the lateral ventricles, which are prominent. This was the section where you can see the cavum, septum, pellucidum, so anterior part. Then this area was a cystic area which was seen. This was the third ventricle. Now normally the third ventricle is not seen so well, but it was prominent here. Then these were the ventricles, because you can see the choroid plexus, bright choroid plexus here. So this is the lateral ventricular region, medial wall, lateral wall. In addition, we were seeing this cystic area in the midline. Now, when you see such a cystic area in the midline, a lot of DDs can come into your mind: arachnoid cyst, porencephalic cyst, interhemispheric cyst, right? So all these things may come to your mind, and you may think that this is a cystic area, and you start thinking on these pathologies. But one basic thing you should always do when you see such a cystic area in the midline: put color. So when you will put color, how we will see how the things will change. Now, in the same case, what again we saw, that when we changed the angle of the probe, this cystic area continued with a tubular area like this. And we could see there is a tubular area connecting to it. Now let us see what happens when we put color. What was this tubular area? I will tell you a little later. When we put color, now what happened? We could see allased color flow in this region, the cystic area filled with color with allased flow. There was an alleged flow and the velocity was quite high. High velocity, somewhere around 135 centimeters per second velocity we could see in the neighboring areas. In addition, the tubular area also that we were seeing, the connected area, I go back, this area also that we were seeing, we can see it more clearly in this picture. This also filled with color. This also filled with color. Now, once the cystic area filled with color, all that those DDs that were in our mind when we were seeing the black and white picture were finished. And usually we do not have any more DDs. So this was taken as vein of Galen aneurysm or a vein of Galen malformation. Right. Now, what is this tubular area? This tubular area is the straight sinus. Now, we all know that in the brain we have multiple sinuses, the superior sagittal sinus, the inferior sagittal sinus, the straight sinus, the transverse sinus. In a normal situation, we are not seeing these sinuses. In a routine case, when we are doing in a normal baby, we don't see these sinuses. We don't see the flow in them during Doppler. But here they were seen very clearly. We could clearly see the straight sinus. And in addition, we could also see the transverse sinus. Transverse sinus lies in the inferior groove of the occipital bone in the inferior part. So these two sinuses were very clearly visualized, which we normally don't. Why? Because the reason was because of this aneurysm, a lot of blood from the arterial side was flowing into the venous side, and as a result, all these sinuses had become very prominently seen. Right, so this is what we can see in a case of vein of Galen malformation. And this is a rare case, but it can always come to you. And you should be very careful whenever you see, particularly you see a cystic area in the brain, you should be very careful that you put color in it. Now, let us see the video of the same case and I'll show you what all we were seeing. Let us start here. You can see the cavum septum pellucidum, the dilated frontal horns of the lateral ventricle. This was the third ventricle, which was also dilated. Then the cystic area was there. The lateral ventricles are dilated. This was the cystic area that we were seeing. And then you can see it continues into the straight sinus, the tubular area. Again, you can see that cystic area. Both the ventricles were dilated. And see here, this ventricle choroid plexus dilated. And then you can see when we put color, this area also fills with alleged flow and the straight sinus can also be seen very clearly. The transverse sinus also in between the baby is moving, so there's a lot of motion artifacts. But still you can see the transverse sinus was also seen. I'll again show you the transverse sinus because it went away quickly. The transverse sinus prominent, the transverse sinus prominent, the straight sinus, the vein of Galen aneurysm, all the things were seen. And in addition, what we noticed was that the ventricles were dilated. And what could be the reason of ventricular dilatation? You can very well make out that this cystic mass is at the base of the third ventricle. As a result, it is pressing over the aqueduct of Sylvius, and because of that, the third ventricle as well as the lateral ventricles were dilated, and that is the reason in the beginning I told you it can lead to hydrocephalus. So this is what you should keep in mind always, that whenever you are seeing a cystic area in the midline in the brain, just put color once to see what it is. Otherwise, a lot of DDs may come into your mind, and once you put color, yes, then those DDs will be just gone, and primarily what would be you be looking at is a case of vein of Galen malformation or vein of Galen aneurysm. Thank you.